So I just presented the results of the COVID-PACT trial. COVID-PACT was a 2x2 factorial randomized controlled trial in critically ill patients with COVID-19. In the study, critically ill patients with COVID-19 were randomized to either full dose anticoagulation or standard dose prophylactic anticoagulation. And then if they were not already on an antiplatelet agent, they were randomized to either clopidogrel or to no antiplatelet therapy. And then patients were followed through hospital discharge or 28 days post-randomization. The primary endpoint in the COVID-PACT trial was a composite of venous and arterial thrombotic events. And what we found is that for the anticoagulation randomization, patients who are on full dose anticoagulation had a 44% relative reduction in the risk of the primary endpoint, 44% reduction in the risk of clotting events. On the other hand, there was no difference between patients on clopidogrel or no antiplatelet therapy in terms of their risk of developing blood clots. On the safety side of things, we found that patients who were on full dose anticoagulation had an increase in non-life-threatening bleeding, whereas there was no difference in bleeding events between patients on clopidogrel versus no antiplatelet therapy. So to summarize, I think what we learned in this study is that for critically ill patients with COVID-19 who are at very high risk of developing blood clots, treatment with full dose anticoagulation reduces clotting complications with an increase in non-life-threatening bleeding. And so weighing these clotting and bleeding risks, full dose anticoagulation should be considered for some appropriately selected patients with COVID-19 who are critically ill.